Welcome to Science, Health and Healing Encyclopedia of Children's Health Corps and Ali Academy. I'm Dr. Majid Ali. The subject of this article is 9/11 cancers, part 1. This video is part of 5 video series on the relationships between various types of cancers observed among those who were exposed most intensely to the 9/11 dust and the related chemicalization of the New York metropolitan environment on September 11, 2001. In the closing weeks of 2011, I wrote my book, September 11, 2005. This was a book of predictions written in a fictionalized past tense. I was so absolutely certain that what I foresaw as the biologic consequences of a combination of terror and toxicity on cell membrane levels, mitochondrial levels, levels of a matrix, which will trigger the onset of diverse illnesses later on, that I thought I wanted to make my predictions in a written format. So if I were to be proven wrong, I would want to be proven wrong conclusively, unequivocally, and accept that I was completely wrong. However, I knew, based on my past predictions, which were founded on my understanding of oxygen homeostasis and the evolutionary design for health and healing, that most regrettably my predictions will come true. Now, anybody who reads that book will know that all of my predictions have already come true except for one. I thought they will build the monument sooner than they did. Cancer is an oxygen problem. I have written extensively. The first part of my 2-volume book on cancer is Disox model of cancer. I present a large body of evidence and my original biochemical and microscopic observations to support my view of the oxygen model of cancer. You can also Google it and you will come to several articles. For professional viewers, I would suggest the 10th, 11th and 12th volume of my textbook, The Principles and Practice of Integrative Medicine. It was evident to everyone all over the world that there are going to be serious oxygen-related problems caused by the inferno, the carcinogen which were present in that 9/11 dust, asbestos, dioxins, formaldehyde, polychlorinated phenol compounds. But I also pointed out that the high temperatures of those times would create new chemicals by mixing and blending the pre-existing chemicals, and no one can truly say that there were only 70 carcinogens present in this dust. In June of 2012, the government officials ruled that cancers would be included among the illnesses which would be compensated for and which are believed to be related to 9/11 events. Now, I read that article, the report, and for my life I could not understand why did this official and the advisory committee behind him decided that they did not want to cover cancers of the pancreas, brain, and the prostate. Now I'll come back to this subject later on. The main purpose of my writing the book was to emphasize the cumulativeness of the environmental stress-related injuries, which will disrupt oxygen homeostasis, cause acidity, cause free radicalization of cells, thicken the bodily fluids. In other words, disrupt oxygen homeostasis at the fundamental level and will trigger a large number of diseases. And of course, my other purpose in writing that book was to see if I could offer some guidelines to prevent, because I thought most of that would be preventable in most instances, certainly in children in close vicinity of 9/11 zone, ground zero. Now 11 years later, everyone can tell that my call for caution was unheeded. In fact, New England Journal of Medicine has famously said that we should not necessarily medicalize the events of 9/11. So I will come back to in part B and focus on why this message was lost and what is the price that people are paying now and will continue to pay for decades because the medical profession could not understand one simple principle of holism, that is the end result of all the injuries which determine whether a person can survive them and remain healthy and live long, useful lives, or will sicken and will develop cancer, lung problems, autoimmune problems, many other disorders. Please join me for part 2. Our vision at this encyclopedia of Children's Health Code and Ali Academy is to provide authentic information untainted by corporate deceptions as well as ideological distortions. You can support us by forwarding this YouTube segment to your contacts and visit kids123.org, kids123.org, if you wish to join our effort to spread this information free of cost to people all over the world. Thank you very much. Thank you.